We're joined this evening by Dr. Michelle Knox with the University of Toledo Medical Center. We appreciate your time. Talking a little bit about ADHD to people who aren't familiar with it out there. What exactly is it, and what are some of the signs you're looking for?
Well, ADHD, as it's now known, it used to be called ADD, and now they've changed the title to ADHD, Attention Deficit Hyperactivity Disorder. It actually has three parts. One is inattention, difficulty focusing, poor concentration, this type of thing. Another is impulsivity, which is things like blurting out answers, can't wait your turn, interrupting others' conversations. The third part is hyperactivity, kind of the moving around, fidgeting too much. What we know about it now is that it's present in about 5 to 7% of the childhood population. Probably it starts very early on. It seems to be a very brain-based disorder. Okay. We also know that it's important for us when we're looking for ADHD and for families who think they might be dealing with that to think about the symptoms in the context of what we would expect in normal development. Because a lot of the things that I just talked to you about, like inattention, impulsivity, fidgeting, moving about, often are really common in younger kids.
Right.
And so we really have to see that to an extreme degree in order to diagnose the disorder.
So is there a dividing line of what's extreme and what's just a normal rambunctious kid?
Yeah, there is. And the nice thing now is that we have measures to tell us when the child has crossed that line. Okay. So we don't have to guess anymore. So we have data on thousands of kids from all across the nation, and we're able to see what typical development looks like with regard to ability to control oneself or to control impulses and that kind of thing. And we're able to see what's 1.5 or 2 standard deviations outside what's typical, and that's when we have concerns. And so we have measures that teachers, parents, and caregivers can fill out. We have observational measures, and we have some computer measures as well, where we can kind of look at these things, track these things, and see if the child is really atypical or not.
So when should I go to a doctor? What do I need to specifically look for? Is there anything I want to specifically look for before I go to a doctor and ask for some diagnosis?
Yeah, what we're seeing, it sort of differs at different levels of development. So, for example, if you're looking at a preschooler, a very young child, you're seeing temper tantrums many, many times a day. You're seeing aggressive behavior that happens every hour, or roughly that. Right. You're seeing a child who cannot share or play with a child for more than a minute or two at a time. So you need to be looking for really extreme behavior problems in young children in order to go, okay, I think it's time for us to get an evaluation.
Okay, so treatment-wise is a little bit more controversial. Where do you guys stand on treating people with it, especially the kids?
Well, yeah, especially the kids, and that's a tough one. The best evidence-based practice in terms of treatment of ADHD right now happens to be medication. We have tried for decades to treat kids in more of a sort of therapeutic talk therapy kind of method, and it's not working, frankly. Okay. What works is medication for moderate to severe cases. We have a lot of parents, understandably, who don't want their kids on medication. Sure. So oftentimes what people like me and other professionals try first is sort of a behavior management program. Okay. Where we really train the caregivers and parents to be experts in managing behavior on a minute-to-minute basis. It's really labor-intensive, but it can have some beneficial effects as well. The third thing that's kind of coming out in the literature now is called neurofeedback. Okay. And it's non-invasive. It doesn't involve medication. It's about training kids to alter their brain waves in a way that's characteristic of people without ADHD. And those kids tend to focus better over the course of many sessions of neurofeedback.
Lots of new things coming on with that. We appreciate Dr. Knox your time, and that is your Talk Back.